The rapid spread of Omicron forces nations to rethink restrictions. Weeks after it first emerged, the new variant of COVID-19 is expected to overtake Delta, but with less severe disease. Will vaccines keep us safe, or are stricter measures necessary? I'm Andrea Sankey, and today's newsmaker is the surge of Omicron. The biggest threat to global public health. That's how G7 countries describe the Omicron variant. The statement from the world's wealthiest economies comes as the UK records its highest ever number of daily COVID infections. In response to the world's now fourth wave of the pandemic, some European countries have reimposed travel restrictions. France instated drastic new limits and effectively banned tourists from the UK. And many leaders are asking people to scale back holiday celebrations as hospitalizations climb.
Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems. I need to be very clear. Vaccines alone will not get any country out of this crisis.
Well, the Omicron variant has been reported in around 80 countries so far, though it seems to cause less severe symptoms. Scientists warn the new strain can be more resistant to vaccines and more transmissible. Now, in the U.S., the average number of daily coronavirus cases has risen by 30%. This week, the U.S. tallied more than 50 million confirmed COVID cases and over 800,000 deaths. Right now, Omicron accounts for just 3% of infections, but those numbers are doubling every few days. The UK recorded 88,000 new infections in one day, a second consecutive record number. British Omicron cases stand at more than 11,000, and the UK has reported its first death directly attributed to the swiftly spreading strain. As studies seem to find, the current vaccines provide significantly less protection against Omicron. Governments are urging people to get boosted. France and Germany are trying to scale up vaccinations amid the surge in cases, and the UK has announced it will accelerate its booster program, aiming to deliver additional shots to everyone over 18 before the end of the year. Scientists still can't confirm how dangerous or innocuous the Omicron variant is, but say booster shots improve both the quality and quantity of antibodies, reducing the risk of hospitalization.
The answer can only be to increase vaccination, to include children above 5 years old, boosting and protective measures. That has to be the answer we give to this new variant.
Due to the steps we've taken, Omicron has not yet spread as fast as it would have otherwise done, and that's happening in Europe. But it's here now, and it's spreading, and it's going to increase. For unvaccinated, we are looking at a winter of severe illness and death.
So how should we respond to the new strain? Well, to answer this and more, joining me from Geneva is Dr. Margaret Harris. She's a clinical epidemiologist and spokesperson for the World Health Organization. From Pretoria, South Africa, is Dr. Angelique Coetzee. She is the chairperson of the South African Medical Association. She was also the first to detect and raise the alarm about the Omicron variant. And in Newcastle, we have Simon Calder. He is a journalist and travel editor at The Independent. Thanks all so much for being with us. You know, when the variant was first discovered, really, in South Africa, we were told it would take a few weeks to determine just how dangerous it really is. Dr. Coetzee, can you make that determination now?
Good afternoon. Yes, but let me say, I will make this determination for South Africa, because it feels to me as if people are thinking that in South Africa, we are either lying about our death rates, hospital admissions, or there's something wrong. So let me say, yes, we can. And the stats speaks for themselves. So we do have the stats. We know that this is a highly transmissible disease. We know that for the past 7 days, our infection rate is 29% to 28.1%. We know that in our ICUs, the number out of 656 facilities across South Africa, there are only 187 all ICU ventilated cases.
Okay. So and I can back you up on that one because I've spoken to a number of contacts and friends in South Africa, and they say, there's no reason to increase restrictions because the virus just isn't hurting people, even for those who have it. But, it may be mild in South Africa right now. The issue is, let me ask you, it's also summer there. There's plenty of sunshine. There are warm temperatures. People are outside. So is there concern about how much worse the virus could actually get when cold temperatures return, and of course having these cold temperatures right now in the Northern Hemisphere?
No, because the virus is not dependable on temperature. The virus is dependable on, as you correctly said, human behavior. And I need to say to you that we have in South Africa for December quite a few rainy days and low temperatures, which is unheard for in South Africa for the month of December. So again, it's now the 5th week from today. It's the 5th week that we are now dealing with Omicron. And I need to say to you, if you look at our stats, when it was the 5th week of Delta, our facilities were overrun. There were no place. We had already started to have difficulties with oxygen supply to the patients. So there's no reason to think why after 5, going into the 5th week, that something else is going to change. In the community, the past 4 weeks, everything stays the same. The clinical picture stays the same. The patients unvaccinated, those are actually the patients that would be admitted. And although very low numbers, the vaccinated people are, for now, safe with severe disease lying in ICUs.
Okay.
And yes, any virus is virulent.
But Dr. Coetzee, you sound relatively confident that at least South Africa has seen the worst?
Well, I don't think we have seen the worst. So our numbers can again go up, especially now after the festive season. But if the clinical picture stays the same, then it means the average person out there, recovery rate is between 5 to 7 days out of hospital. In hospital, what they have done, so for those patients that's been admitted in the normal COVID wards, length of stay is between 2 to 3 days. So as long as it stays like that, and with minimum of people in ICU needing oxygen, I think that I can live with that.
Okay. Let me turn to Dr. Harris in Geneva and get your thoughts on what we've just heard, because a lot of people really feel like they're getting conflicting messages with statements like the G7 saying Omicron is the, quote, biggest threat to global health, and then the WHO constantly very concerned. But then here's South Africa with huge case numbers, yet they're not increasing restrictions and hospitals are really managing just fine. Is there a risk, this is what worries me, is there a risk of kind of the boy who cried wolf here when it comes to certain authorities? Some saying we should be scared and others saying, really, take it easy, we're going to be fine.
Well, first of all, I want to say thanks so much to Dr. Coetzee and her colleagues in South Africa for doing not just brilliant science, but really transparent science and providing the world with so much information in real time. We haven't had this advantage before, and it really is down to the work of people like Dr. Coetzee. Now, on the situation, it's evolving. So people are naturally looking to different bits of information and in a sense maybe cherry picking. Now, of course, we all want it to be a less severe disease, and certainly the information that Dr. Coetzee and colleagues are providing us every day is giving a very positive indication in that direction. But, and here's the big but, and this is why people are saying, no, we have to take this seriously, it's a numbers game. If you have huge numbers of people infected, and we're seeing growth rates much, much faster, much, much more severe with this, the speed of infection is much greater. with this variant than with previous ones. That means you have very large numbers of people who potentially get the severe form of the disease, and those people end up in hospital. Also, the structure of the populations in Europe, North America, other parts of the world are different in age terms. We've got many, many more older people here, many people with chronic disease that may not respond so well to infection and therefore need to be in hospitals. And we are getting information from countries like the United Kingdom that their hospitals are indeed filling up.
Okay.
There's concern in other European countries on that matter as well. So that's why all the authorities are saying, look, take the measures now to dampen down, slow down the transmission.
Is there a fear, though, that part of this and the fact that, you know, in countries like South Africa, people are still, there are very, very limited restrictions. People are out socializing. It's the holiday season. That with that gathering, a stronger, more mutated strain will develop out of that could be much worse and could cause severe disease? Or have those dangerous mutations, are they finally tapering off?
So this virus is mutating all the time. The fact we're down to Omicron in the Greek alphabet indicates we've looked at many, many mutations of this virus. We only have 5 on the variant of concern list. Most of the others are on what we call the variant of interest list. But this virus, because it's an RNA virus, changes all the time. Most of the time, those changes don't matter or aren't too serious. But when we get information, as we were provided with, as I said, so quickly and so transparently by South Africa, if we get information that indicates it's got the potential to cause problems, we put it on the variant of concern. But it won't stop mutating until we stop the transmission. So that's why we all have to play a very important part in this.
Okay. Difficult to reconcile that we all have to play this important part and try to stop the transmission, but that when we see South Africa doing just fine without increasing restrictions, it's hard to understand and make people understand exactly what they need to do and how vigilant they have to be. And that, of course, brings us then, Simon, to travel restrictions. And now we've just seen the biggest step taken, arguably, is France banning travelers from the UK. No tourism over the Christmas season when, you know, Britons have time off. They wanted to go to Paris, go shopping around Christmas time. They can't even do that. From your view as a travel writer and knowing the industry, is it necessary, do you think?
We have been taken by surprise, but the problem is that, well, if we can just roll back 3 weeks, South Africa has been served extraordinarily badly by other governments in terms of travel restrictions. As we've been hearing from Dr. Coetzee and of course from Dr. Harris, you know, fantastic work has been done and that has been shared with the world. What South Africa has been rewarded with is countries like the United Kingdom and many others saying, oh, right, we're going to ban all flights. We're going to make anybody coming in from South Africa go into hotel quarantine. We simply are going to not just cut down flights from South Africa itself, really important, of course, in both directions, many family links with the UK and many, the South African tourism industry absolutely dependent upon on the UK market. And that has spread. Other countries have done the same. Thankfully, the UK just in the past few days has removed its travel ban, but the damage has been done. We're just 8 days away from from Christmas Day. It's the peak of the winter holiday season, and South Africa has been penalised for being absolutely open and honest. And yes, that we're now feeling a bit of that in the UK because we've been banned from France. Really serious for hundreds of thousands of families, separating us from our nearest continental neighbour.
I mean, Simon, if you could talk in even a little more detail about the real economic consequences here, because, I mean, for example, Britons love South Africa, especially in the winter. And it's been taken off the red list now, but it's still kind of, you know, hovering overhead. Some tourists still worried about, okay, we can travel there and we can return right now, but we don't know what they're going to say in a week, so let's just avoid that destination. because it could be problematic. So how much does South Africa's tourism economy, which is essential, really take a hit, even with restrictions now lifted?
It is. I think when we look back on this, we will regard this as one of the most scandalous terms of the whole miserable crisis. The fact that there are many, many people in South Africa involved in the business of delivering great tourist experiences. And that market has been taken away from them largely over the peak season of the first winter when, northern winter, of course, wonderful southern summer, when they thought they would be able to start making things back. Now, exactly as you say, what the UK government has been doing absolutely undermines confidence. For actually most of the last 12 months, South Africa has been effectively out of bounds to the UK, even though, as we know, it's got a fantastic health service, it's got brilliant medical people there, and yet the UK and many other countries have regarded it as too dangerous. And I think we now need to move on and recognise that, of course, your great medical experts will know more than me, but it seems to me we do at some stage have to recognise that COVID is endemic and just live with it and start repairing the tourist industry, the travel industry, and of course, across. Yeah.
Let me just go back to Geneva then quickly and the WHO and get your point of view on this. When Simon and others say we just need to move on, does it make you a bit nervous? Does it make you feel like people want to forget that this is even happening now and we're not ready for that?
Well, I think people have been wanting to forget COVID for about 2 years already. Unfortunately, COVID won't forget us. COVID wants to be in our bodies and spreading from person to person. On travel, we certainly don't like travel restrictions, don't like bans on travel. We do ask that people take precautions, so wear the masks, get vaccinated if you can, ensure and ask the airlines and so on to ensure that they take all the precautions, and that, of course, countries manage their borders, understand who is going where, who's come in, who's come out, how to follow up people, and ensure that they can track and trace and test. So we ask all those things, but on actual travel restrictions, this is not something that we like to see.
Okay. Dr. Coetzee, let me ask you, because you've said, leaders shouldn't panic, that it was unfair for the UK in particular to put South Africa immediately on this red list and ban that travel and hurt the South African economy even further. But you've also said that governments cannot be complacent. So the problem is, no government official wants to be left, holding the can. So if South Africa arguably has to suffer while they're seen to be, protecting their people and their publics, they can't be accused of complacency. So how do you address that?
Thank you. Good questions. So, first of all, we said right from the beginning, there's data that we don't have. There's a lot of data or answers and questions being asked, and just give us time.
Okay, let's.
Can you hear me?
We can hear you. It's coming in and out. Let me just cross to Simon quickly. Simon, I see you had a comment. Let us redial Dr. Coetzee. Simon, go ahead.
Yes, well, if I can perhaps fill in on what Dr. Coetzee, I think, will have been recommending, which is what an awful lot of people in the travel industry and outside it would recommend, which is, sure, when you've got a variant of concern, then you can very easily, because we're used to this, put in more testing regimes. You can, tighten up. You can, exactly as you say, as Dr. Harris would say, have really good track and trace systems, so that when somebody does test positive for Omicron, you can then work out where they've been and where they are. But unfortunately, we have seen this time and again that governments need, they think, to be seen to be doing something. And, well, look, I met all the people who come out of South Africa when they were finally allowed out of their quarantine hotels, and to a man and a woman, they were on the verge of tears. They just felt that they had been used as political pawns, that they didn't present any threat. And indeed, the ridiculous thing was they were probably safer inside their hotels than they would be on the streets of London.
Okay. We're still trying to get Dr. Coetzee back, but let me return to Geneva, because we're at the point now where, leaders in all developed countries really at this point are calling for these boosters. That's going to help us really prevent. Even if Omicron can evade some of the vaccines, with boosters we are significantly safer. But at the same time, we're still talking about vaccine inequality. And we're seeing too many cases where vaccines, however, are available, and I can see Dr. Coetzee coming back. I would love to have her comment on this. Vaccines are available, for example, Dr. Harris, in South Africa. Yet we're only seeing a rate of about 25% of the population fully vaccinated. They cannot force people to take them, and people don't want to take them. So developed countries were criticized for going ahead with booster campaigns and encouraging people to go get their third shot, while the WHO was saying, no, please don't, let's get everyone else vaccinated first. And here we are, we're countries where it is available and people won't do it.
So there's a lot of issues there, but it's really important to make it clear we're not against boosters, we're against vaccine inequity. What we do know is getting the most high-risk people vaccinated with their first dose is the most important thing you can do. First and second dose, so they have a full course. So you've alluded to that already, that there are, even in countries with a lot of vaccines, we still have significant pockets of people who've not been vaccinated at all. And this could be for a bunch of reasons, not just because they're afraid of the vaccine or they don't like it or they've been listening to misinformation. It may well be that vaccination wasn't available the day they went to their doctor, and they're not somebody for whom going to the doctor is an easy matter. They may be somebody who works daily for their food, and they only have enough money to put food on the table if they go to work that day. If they lose a day of work waiting for a vaccine, they can't feed their children. So they've made the decision to feed their children before getting the vaccine. So there's a lot of work all of us in public health have to do in every country to understand why we have people who've not yet received their primary vaccine. And that's in countries with lots of vaccine. Now, we know in countries with hardly any vaccine why they're not getting it. That's because the supply around the world has not been fair and has not been fairly distributed. That is improving. We've been able to distribute way more doses of vaccines in the last month than we have in the entire year. So we're doing a lot better now with the distribution, but it is critical that in every country, instead of ignoring the people who are unvaccinated, that work to reach them. And it's the hardest last 9 yards, but that it's critical because, again, when you have a virus racing through your population and infecting so many people, it's that small percentage but large number of people that will get the severe disease and sadly will die.
Okay, I can see we actually have Dr. Coetzee back from Pretoria. So glad you could rejoin us. We're down to our last couple minutes. If you want to pick up where you left off before, but I also wanted to have you comment on what Dr. Harris was saying about vaccine inequity and the issue specifically you're having in South Africa, where there is a supply of vaccines available, but only 25% or so of the population is fully vaccinated because people are just not getting it. Is it a lack of trust? What is it, and how detrimental could it be to fighting the pandemic going forward?
Very good question. Yes. So what we see in South Africa, and what I have asked all my patients since Omicron started, why are you not vaccinated? Because nearly half of the 90 patients that I've now seen with Omicron, half are vaccinated, other half are not vaccinated. So the non-vaccinated, very interesting, they all still want to go to get vaccinated, but they don't have time. So I call them lazy. There's no time, but they will make time. So I think one of the most important things is that the vaccine should be taken to people and not the people to the vaccines. Then boosters, we are going to start with boosters for the higher, older group, the more vulnerable people, and that will start in the beginning of January. However, regarding boosters, I think what needs to be done, especially in the first world countries, where they are now all giving boosters while there's still a lot of inequality in Africa, is for each and every booster that you as a first world country administer, adopt a buddy booster in Africa or in the lower income countries and donate. So every booster, donate one to Africa or wherever it's needed. And I think that would help with the inequality that is out there, because no one can sleep safe if Africa is not safe. And I feel very strongly about this. The most important thing is to get actually boosters, not boosters, but vaccines, first dosages in as much arms as possible. You must protect your other people as well with boosters, but it should be a phased-in project.
Okay. Dr. Angelique Coetzee, I will give you the final word. We're unfortunately completely out of time for this edition of The Newsmakers, but I also like to thank Dr. Margaret Harris and Simon Calder joining us there from the UK, and our viewers as well for being with us. Remember, you can follow us on Twitter at @the_newsmakers, and be sure to subscribe to our YouTube channel. I'm Andrea Sankey. We'll see you next time.